Shifting patients inside and outside the OR. Goals: giving importance to patient safety, taking care of vulnerable patients, giving a choice to the patient, to prevent falls or accidents while shifting, to use the correct method while shifting, not based on appearance or availability of shifting resources. Different ways of shifting the patient to the OR. Escorting the patient by wheelchair, by stretcher or trolley. Who will take a decision? In the block room, in-charge sister in the block room, circulating nurse, GA sister. In the operating room, operating surgeon, assisting sister and the circulating nurse. Escorting the patient. Before escorting, cross-check the patient details with the case sheet, ID card and wristband to avoid taking the wrong patient. Age will not be the only criterion to escort the patient. Other criteria such as vision, systemic disease status, and physical disability are also important. Young and middle-aged patients can be escorted without hand-holding. Patients who require assistance or assurance can be escorted by holding their hands. While escorting, strike a cordial conversation with the patient, which will help you confirm the details in the case sheet and also to reassure the patient about the procedure. Shifting by wheelchair. Vision is less than 6 by 60 in both eyes. One-eyed patients, asthmatics, uncontrolled BP patients, diabetic patients with small foot ulcers, obese patients, patients finding it difficult to walk due to knee problems, old patients more than 75 years, patients requiring two procedures like phaco with retina surgery. Safety while shifting in wheelchair. Cross-check the patient details in the case sheet with ID card and wristband and the patient to avoid taking the wrong patient. Case sheet should be placed behind the pouch in the wheelchair. Two envelopes should be involved in the shifting. First, the wheel lock should be engaged and the footrest should be raised before mobilizing the patient. One envelope should stand behind and hold the wheelchair in position, as the other envelope helps the patient to sit on the wheelchair. The safety band should be secured around the patient. Make sure that the patient hands are placed inside the chair to avoid injury while negotiating the doors. Inside the OT, two envelopes should be there while shifting the patient from the wheelchair to the operating table. Shifting patients by trolley. One-eyed patients with less than 6 by 60 in the seeing eye, IV mannitol patients, cardiac patients, renal patients and patients undergoing dialysis, foot ulcer patients requiring plastic cover for the foot, very obese patients, GA patients, and IV sedation patients. Precautions while shifting the patients on trolley. Patient case sheets need to be checked with the patient's ID card and wristband with the patient to avoid taking the wrong patient. The stretcher cloth needs to be placed over the trolley and the iron rods should be inserted. The trolley needs to be moved near the bed and height is lowered according to the patient's comfort. The trolley wheels have to be locked. Four envelopes should be there to assist the patient to shift the wards to the trolley. Then the side rails have to be put in place and the belt secured around the patient. The trolley needs to be moved with two people, one person in the foot end and the other person in the head end. Care should be taken not to bang the trolley against the wall or the OR doors. Precautions while shifting patient on trolley. In the OT, the trolley is placed parallel to the OT cot and the height is adjusted in level with the OT bed. Four persons, two at the foot end and two at the head end, should shift the patient to the OT bed. Care should be taken to place the patient's head over the headrest of the OT table and the bedsheet should be tucked below the patient's shoulders. The same procedure of four persons, shifting the patient back to the trolley, should be done after completion of the procedure. Shifting the patient outside hospital. From ICU to the ambulance, different ways of shifting. Wheelchair to shift asthmatic patients with oxygen support. Trolley with head end propped up in case of pulmonary edema with oxygen mask. Trolley when the patient is unconscious or intubated. Who will decide? Anesthetist, the physician, or the night duty doctor? Role of GA nurses or senior MLOP in charge. Ensuring oxygen mask is in the correct position. IV line is fully secured. IV fluid is in flow. Crash cart must be in place and emergency medicines to be given as advised by the doctor. Relevant investigations like ECG and RBS to be checked as required. Intubation instruments to be kept ready. Defibrillator is prepared and jelly should be available. Urine catheter to be inserted with the help of doctor. To secure the amber bag in case of CPR. And accompany patients in the ambulance. Role of MLOPs in emergency. Inform the duty anesthetist, physician or the night duty doctor concerned. getting the oxygen cylinder in place, securing BP apparatus, IV stand, ECG machine, getting ready the nebulizer machine, getting the supplies as requested by the GA sister or the senior MLOP in charge. Inform the operator room or transport manager about the need for ambulance. Getting the help ready for shifting the patient to the stretcher. Getting the referral letter and the case sheet if required for transfer to a higher center. Role of duty doctor. To monitor the pulse rate, BP and respiratory rate. Record these findings in the case sheet with timing. Record the medications and the procedures if done. Assisting the anesthetist or physician in managing the patient. Helping in CPR. Accompanying the patient in the ambulance and handing over the patient in the referral center. Thank you.